Well, Doc, of course, we want to talk about diabetes and COVID-19. Pero let's lay some baselines first. Let's establish first yung what you need to know about diabetes. Kasi to tell you frankly, a lot of people have a lot of misconceptions about diabetes. And it's born from the fact na from an early age, for example, ako, sasabihan ka na huwag kang kumain ng masyadong maraming asukal kasi magkaka-diabetes ka.
Mm-hmm.
So,
Soft drink.
kino-correlate ng mga tao yung ingest mo ng sugar, whether in candy
Yes.
o yung asukal mo sa kape, dun sa pagkakaroon ng diabetes later on in life. So there are things like that. So let's lay the baseline first. What exactly is diabetes? We do know that it's a failure of the body to process glucose, sugar in the bloodstream and turn it to energy. Pero in very real and practical terms, exactly what is it?
Diabetes is literally a high blood sugar. So it's we have high levels of sugar in the blood. And this is a chronic disease. This is not a disease that is treated in 1 month, 2 months. No, this is a chronic one. So this stays with the person for life once he gets it. Yes. And generally, this is an interplay between genetics and environment, especially the lifestyle. So as you said earlier, eating sweets early on in life, that is because that may predispose a person to having diabetes later on, because that is an early practice of a bad lifestyle. That's the reason for it.
It predisposes talaga. Akala ko ito sa myth. So
Hindi ka pwede kumain, Edna. Ang matandis.
But remember, not everyone naman who eats sweets will have diabetes. It's just that if you have it early on in life, if you keep on eating the bad food, sweets, for example, that is a route already for having the unhealthy lifestyle, which may contribute to the development of diabetes later on in life.
Mm-hmm. Pero Doc, bakit what's the connection between diabetes, yung high sugar content in your blood, and for example having problems with your wounds not healing, alam mo yun, yung gangrene in the foot, and so on down the line? What's the connection there?
Well, actually, with people with diabetes, they have a problem with wound healing. There are a lot of factors. So parang yung sinasabi natin, the soldiers that fight off diabetes in the blood, they're not very efficient. So fighting off the microbes, the bacteria may not be as efficient in people with diabetes compared to those who do not have diabetes. So in all infections, so that's the reason why people with diabetes is more predisposed to having wounds, infection, because their ability to fight off a disease may not be as efficient as those without the diabetes.
Doctor, I'm intrigued by this detail, that diabetes is the second most common comorbidity in COVID patients. Saan po nakabase ito? Are you monitoring this nationwide?
Yes, we do have a local report, and they have been studying the characteristics of patients with COVID-19 in our country. But that data has already been presented early on in the pandemic. As early as January, there were reports coming from China, of course, because they are the ones who reported the case early in the pandemic. So the data that we commonly see, like this one, with the diabetes being the second and one of those diseases that are most common comorbidity in COVID-19. So doon natin nakuha yun. But we do have data now. And yes, diabetes is very common in patients with COVID-19.
Ano yung number one? Heart problem?
Yes, hypertension, comes obesity, yes.
Okay, I don't want to sound morbid, kaya lang, is it also a big factor in the fatalities from COVID?
Okay, that's a good question, ma'am. Actually, that's a favorite question of my patients to me. Doktora, may diabetes ako, magkaka-COVID ba ako? Well, as I said, as a baseline, people with diabetes can get any infection. Okay, more prone sila than those without diabetes. However, if their blood sugar is controlled, then the outcome, or what we call the prognosis, even for COVID-19, is favorable. So you will see that yung death rate for those with diabetes is favorable for those who have controlled diabetes compared to those who have uncontrolled diabetes. So it's very important really to emphasize that they have to control their diabetes.
Doc, you
Okay.
make a distinction between controlled and uncontrolled diabetes. Exactly how is that distinction made, and who is which?
Okay, so generally when we talk about control, we talk about numbers, okay? So we have the blood glucoses, we have the HbA1c, so we have certain levels. If we are going to be technical about it, so we have a 3-month average blood sugar, and that's what we call the HbA1c, or the glycosylated hemoglobin. So in layman's term, no, so ito yung gaano kataas yung sugar na nakakapit sa red blood cells, because the lifespan of a red blood cell is around 3 months. So yun yung kinukuhang average. So when we say average, the controlled level would be 7% and below. So that's in the general population. Yung mga bata, we aim for 6, 6.5, and closer to normal as possible. Now, for those who are just monitoring, no, if you have a capillary blood glucose, yung glucometer sa bahay, if you're using that, and you get a fasting or pre-meal blood sugar that is generally between 80 and 130, you're good. Okay? Kung nakakain ka na and your blood sugar, you get your blood sugar at 140 to 180 milligrams per deciliter, and then you're good. So that will give you a good gauge, oh, okay ako. So mas maganda. Then the next time you see your doctor, you will be more confident na maganda yung papakita mong result ni doctor. And most likely, sasabihin ni doctor sa'yo, you are controlled. Okay? So also for the symptoms, so walang symptoms, walang mga sugat, no comorbidities, this will be the patients with diabetes who have controlled levels of blood sugar.
What is this? Yeah.
Sige, sige,
Go ahead. What is this concept of patient adherence? Exactly what does it mean, and what exactly is it that you're talking about?
Okay.
When you say patient adherence.
Okay, adherence po is how the patient follows what we talked about regarding his or her treatment during our consultation. So it is from the medications, from the diet, the exercise, what he or she should do and should not do. That is really how the patient follows this through. And adherence, with the adherence, it's connecting to the plan. Okay, so the plan of management, which of course we discuss with the patient has a say on the management of his or her diabetes, for example, its condition. So what we talked about our plan, so the patient has to follow that even when they're not seeing their doctors. So that's adherence. It's actually sticking it to the plan
Sumunod sa kasunduan.
treatment. Yes, ganun po.
In other words, sumunod kayo sa kasunduan nating dalawa, parang ganun.
Yes, but of course, this is adherence. No, this is not just compliance. Compliance po kasi means they just comply. They will just follow it, whether or not they agree with it. So better is the adherence, and we always teach or remind our patients that na kahit wala si doktor, gagawin niya yung part niya. Tama po kayo, yung kanya pong commitment doon sa part that he agreed on.